morning. I'm very, very happy to be here. From remote world, from technology world to real world and real people. And even though in agenda you can see that there is written that there will be show, I should say that I'm very, very bad in shows. But I want to talk about people. Because I truly believe we here are because of people. We are developing our technologies. We are blending clinical knowledge with technology knowledge. We are doing research. We are having those events because of people. And I want to talk about this young mom in a rural area who, because she doesn't have good enough access to public transport, cannot visit pediatrician as many times as she need or she want. I will talk about those happy Maltese people who are having remote monitoring and they do not need to leave their homes. I will talk about those elderly people who are having smart beds, like one from our partner, �W𝐞𝐝-𝐓𝐞𝐿, and they have guidance and their care professionals can provide guidance how to make their life better. And I will also talk about those who need to travel and see doctor because they do not have access to those remote monitoring solutions. And I will also talk about clinicians, the ones who are using conversational AI, as we heard in one of the keynotes this morning, and they have free up their time to talk to their patients and hear their stories and in such a way be able to help them much better. And also for those nurses that are overwhelmed with all that they need to do because they have a lot of paperwork, they need to do coordination manually because they lack the collaboration platforms. And we have heard today already about so many good solutions that we have, about so many initiatives that we have. The question is why we still have those people who do not have access to all of those nice things. And we have those who have. And I think we can do much better and more to make it more equal and more accessible. And we actually proved, this community and we as a society, that we can do this change management. We can use technology, we can introduce telemedicine solutions. Our COVID pandemic that just hopefully is ended, but we saw that those who are using virtual health solutions, actually they are satisfied with what they are getting. And also today we heard many times that virtual health, telehealth works. We also saw that there is continuously growing burnout for our care personnel. And we need to make sure that we are freeing up their time in order they can do a better job and be also more happy in their lives. And this was also mentioned already today, but I really want to stress again and again. We see also growing security concerns. We need to make sure while we are developing our digital solutions, while we are implementing them, we are taking care of patient data. We are taking care of security in such a way ensuring that nobody will access those data with a wrong intention. And now I want to show one video, and let's see whether I will have sound or not. But this video is my dream situation for everyone who do not want to go to doctor through traffic jams and save doctor's time and patient's time. And this is something that we did together, Microsoft with Nuance, and this is how it works. Let's see whether this will work here.
The Nuance Dragon Ambient Experience, DAX, securely captures and contextualizes physician-patient conversations, automatically creating clinical documentation for virtual visits, all within Microsoft Teams. This video shows Nuance DAX integrated into a Microsoft Teams virtual visit between Lucas and his doctor, Dr. Fernandez. The healthcare clinic scheduled an appointment for Lucas and Dr. Fernandez through Microsoft Teams and the Microsoft Bookings app. Lucas received an invite with a link to their virtual visit in Microsoft Teams. The patient joins the visit from their email and is admitted to the lobby. Meanwhile, Dr. Fernandez gets ready for the visit and has her calendar side by side with her chat. When she joins the visit, she sees that Lucas is waiting and admits him into the meeting. When the visit starts, Nuance DAX sends Dr. Fernandez a message. This separate conversation with DAX enables her to start, pause, and resume the recording. When the recording starts, a banner appears to alert the patient that the visit is being recorded.
Have you had this happen before?
During the visit, audio for DAX is securely captured through Microsoft Teams. The entire conversation is recorded and diarized with high accuracy, so nothing is missed, lost, or forgotten. After the visit ends, artificial intelligence automatically converts the conversation into a standardized, structured clinical note that goes through a brief quality review process to check for accuracy, omissions, and appropriateness before being delivered for signature directly into the electronic health record. Nuance DAX for Microsoft Teams promotes a better telehealth workflow experience for both patients and providers by powering virtual visits with clinical documentation that writes itself.
Bye.
It is already existing and it is working. But why we cannot have this everywhere? There are a couple of challenges that we need to acknowledge and we need to work on. And the first is that we have and we will have more and more data in terms of value, in terms of variety, in terms of different standards. And we need to make sure that we can put those data together and have meaningful insights. So this will not happen just because we have those tons and tons of data. We need to work on this to have those meaningful insights. We are still very siloed. One of the research that I read recently said that in each hospital, there are at least 12 different systems where patient data are stored. And those that are coming from tech world, of course, you will say, yeah, so there is a lot of work in order to normalize, to standardize them, to make sure that they are qualitative in terms of timeliness, in terms of the same classification, etc., etc. So this is, again, one more aspect that we need to work on, and we need to make clear that those siloed data are coming together. For this, we need governance. And at the moment, we still can see that in many, many organizations, there is a lack of data ownership, because we need those business data owners, we need those clinicians or those who understand what those data mean to be owners of those data. And yes, you will say, clinicians are taught to do different things. I fully agree. But let's then blend together technological knowledge and clinical knowledge and make sure that owners of the data can do their job. And we also need to always be on top of compliance and legislation. That is, again, one more aspect to take care. And then last but not least, in my opinion, this is the most important thing to make all this work is culture. We need to have in our healthcare organizations and beyond data culture, data-driven culture. We need to understand that we all are in charge in making sure that data are not siloed and we can use them to get better insights for better care. And yes, we will need training for our people. We will need to upskill them, but I think this is a good thing to do, and it is not so difficult because the results afterwards and the outcomes will be very, very impactful. And today we heard about many different solutions that were covering many different areas in customer journey, in clinicians' work, but I like to look at this whole healthcare system in a more holistic way, so that we are not missing each and every person in this whole universe. And this is, of course, about patients. There are a lot of things that we can do with technology for our patients, starting from virtual care-based, ending with personalized care. And we already are doing a lot. But we cannot forget about clinicians. We cannot forget about those who are providing care. And only if we will think about both of them, we will have this total experience where they will be able to work together and cooperate, and as a result have better clinical outcomes. And we need to think about how we can coordinate care, how we can automate processes, how we can make nurses and clinicians collaborate seamlessly in collaboration platforms, and of course, remote patient monitoring. Today we heard many times, and we will hear, I think, more, because this is something that we discovered is a great helper to provide better care. But then there are two more elements that we cannot forget. This is enhance clinical experiences and improve clinical and operational insights. And for clinical experiences, there are so many things that we can do in order to improve clinical process. We can automatically create medical documentation, as I showed in a video, and many more. We can have diagnostics intelligence, something that you can check also today with our partner Irene on eye diagnostics. It is a big help for clinicians. It is a big help also to patient and analytics, because we need to be able to optimize the way how we provide the care by using operational insights, and also we need to learn and we need to get new knowledge from clinical analytics. And all of this will be possible if we will be able to remove those barriers among different data sources, and there will be no silos of our clinical and operational data. And I think this is something that we need to focus on, because without data in the middle, it will be difficult to achieve those so much needed outcomes. And I want to share one case from Czech Republic. When I learned about the case about digital hospital initiative that is run by government of Czech Republic and many partners, including us, my first reaction was, this is one of the examples that clearly shows there are no small or no unimportant solutions in digital healthcare. And there are not enough, and there will be always not enough innovation, use of artificial intelligence in care provision. Because this project put together patient journey and also care journey in one digital space, where people who want to make decisions can learn and understand how it works, and they can also then implement the whole holistic concept. And here you can see one of the examples that is from doctor's office, but there are many more. Starting from booking your visit, looking for the information, and apparently small thing, finding parking place when you are visiting doctor, ending with real innovation, AI-based diagnostics, clinical insights. And this is about main thing that there are no small things in this journey. And I think all together we can make all those solutions more accessible to this young mom in a rural area, those elderly people at their homes, and also us who are using all the solutions and are keep taking care of our care. And this is how we will get better experiences, better insights, and better care as a result. Thank you.